Hi, this is Dr. Angel from Convergent Therapies. Today we're going to be talking about how to stretch our hip flexors out. If you've already seen the video on how to work the trigger points out of our hip flexors with the kettlebell, that's a really great way to get started. This is a great way to strengthen our opposing muscles, our glutes and our lower abs, which will help to actually take the whole psoas and retrain how long it should be. So if you have modern day problems like low back pain and hip problems largely from sitting too much, this is going to be an amazing stretch for you. So you have three different options depending on how your body feels and how much you can handle. The first and easiest way, if your knees can handle being on your knees, is to just get down like this into a half lunge here. I'm going to be up on my toes in the back a little bit, and we're going to start to get going forward here. Now in this position, I'm going to wiggle my hips around a little bit and try to make sure that my hips are pointed straight ahead, that my belly button is pointed straight ahead, and then I'm going to try to line the rest of my body up somewhat. Now, right now we have a lot of tension through the front of our body, so to take some of that tension off, we're actually going to sit backwards a little bit with this hip so that my hip is now behind my knee. When I do this, it really unlocks my pelvis to be able to practice this tilting motion. So what we're going to do here is called the posterior pelvic tilt by lifting up on our abs in front and pushing down on the glutes and back. It looks like that. You'll notice that that totally flattens my low back here. So I'm going to hold that position. I'm going to get that tuck. I'm going to squeeze my glutes and squeeze my abs to push my hip through right here to bring everything forward. Now I'm going to maintain everything going straight ahead. Back is really flat. I'm squeezing my glutes. I'm feeling a good stretch through the front of this hip here. I don't have to go any farther. Then finally, I'm going to interlock my fingers like so. I'm going to bring them up overhead, get my head tucked back, get those shoulders up. We aim for something like this with this stretch here. You're going to hold that for 30 seconds. Now, if your knee can't handle that stretch, what we do is called a modified warrior two position from yoga. To do that, we're in the same type of position, one leg in front of the other, hip is back. We try to get, again, everything straightened out. Go back a little bit here to allow for that posterior pelvic tilt, and then stepping into that lunge, keeping everything there. Again, arms go up, everything sits in that nice line as best as possible. Our last option is what's called the couch stretch. To do the couch stretch, we're going to grab a couch or a chair, something that's pretty low to the ground that'll help your knee out. You're going to sit there in your knee, you're going to sit back a little bit, do your posterior tilt, step forward, make sure everything is still in line, and then once you have that stretch, just getting up and over as best as possible there. This is a really good stretch, and if you're having some of these problems, you should be doing this at least twice a day for 30 seconds on each side. Let's try that out and see if that helps with some of your pain and stiffness. This has been Dr. Angel from Convergent Therapies. Have a great day.